Good day everyone, I am Jennifer Elmadamba, a student nurse from Isabela State University at Tiague campus. Today, I will be showing you my return demonstration in oral and drug IV preparation. First is the oral medication preparation. The purpose of this is to give a medication that has a systemic effect or local effect on the GI tract. So first step is the assessment. First, assess allergies to medication, ability to swallow medication, presence of vomiting and nausea, specific drug action, side effects, interaction, and adverse reaction. Next, client's knowledge of and learning needs about the medication. Next is to prepare the following materials or equipment needed. We have here the client's MAR, medication tray, disposable medication cups, plastic cups for tablets and capsules, and calibrated cups for liquids. Next is to perform hand hygiene and observe other appropriate infection prevention procedure. Alcohol. Next is to unlock the dispensing system. Next is to obtain the appropriate medication. First is to read the MAR and get the appropriate medication from the shelf, drawer, or refrigerator. The medication may be dispensed in a bottle, box, or unit dose package. So we have here the paracetamol, tablet, and syrup. And next is to compare the label on the medication container or unit dose package against the order on the MAR. So we have here the paracetamol syrup, 250 milligrams, and paracetamol tablet, 500 milligrams. So next is to check the expiration date of the medication. They are both good for this year. Next is to use only medication that has clear and legible labels. So now we go on into preparing the medication. Next is to calculate the medication dosage accurately. So there would be no more or no less medication be administered in a client. Next is to prepare the correct amount of the required dose without contaminating the medication. So now we go on into the tablet and capsule medication preparation. So first, put the medication directly into the medication cup. So now, do not remove the medication from the package until the bedside. Next is to break only scored tablets if necessary to obtain the required dosage or correct dosage. Next is to, if the client has difficulty swallowing, check if the medication can be crushed. If it allowed to be crushed, crush it into a fine powder with a pill crusher or between two medication cups. Next is to mix the medication with soft food or water. Next, we go on into the liquid preparation. First is to thoroughly mix the medication before pouring. Next is to remove the cup and place it upside down on the countertop. The rationale for this is to prevent any contamination inside the cup. Next is to hold the bottle away from the label, like this, and pour the medication away from the label. Next is to get the medication cup, which is the calibrated cups, and place it on the countertop, and at eye level, fill it on the desired level. Wait lang. So we will get 5 ml. 5 ml. So, before capping, wipe the lip with a paper towel. This will remove from any sticking of the medication. So, when giving a small amount of medication, for example, less than 5 ml, prepare the medication in a sterile syringe without a needle. So, we will get 2 ml of the medication. So now, and label the medication with its name and the route. And after all, place the medication and the medication card on the medication tray. Here. Before we go on, recheck the label on the container before returning it to the box, envelope, or to its storage place. And lastly, prepare the client for administration. So we go on check 2 ml, 500. It's correct. So we will label the medication like this. This is just assume that this is a label. And that's the oral medication preparation. Next is preparing medications from ampule. So here are the first step is the assessment. So first is to assess allergies to medication. Second, specific drug action, side effects, interaction, and adverse reaction. Next is to client's knowledge of and learning needs about the medication. Next is the intended route of the parenteral medication to determine the appropriate size of syringe. Next is to ordered medication for clarity and expiration date. Next is to prepare the medication. Prepare the following materials or equipment in doing this medication. First is the syringe, sterile gauze, ampule, and alcohol swab. So, next is to check the MAR. So, in checking the MAR, check the label on the ampule against the order on the MAR to make sure that the correct medication is being prepared. So, paracetamol 2 ml and paracetamol 2 ml. So, next is to always follow the 3 checks of administering medication. So, next is to perform hand hygiene and observe other appropriate infection prevention procedure. Next is to prepare the ampule for drug withdrawal. So, first is to flick the tip or top of the ampule so that the for example like this, so the medication here will be going down here, so like this. Flick it several times, and yes, and clean the ampule with alcohol swab so that this will prevent any contamination once we break the ampule. Next is to use a sterile gauze or ampule opener. Since we have sterile gauze between your thumbs and the neck of the ampule, break the ampule by bending it towards you. Next, dispose the broken glass or the top of the ampule on the required container. Next is to the withdrawing of the medication. So in withdrawing the medication, place the ampule on the flat countertop or flat surface. Next is to attach the filter needle to the syringe. Since we don't have filter needle, let's just assume that this one here is a filter needle or filter straw. Next is to remove the cap of the filter needle and put the needle on the center of the ampule. Do not touch the rim of the needle. So, in doing this, next is to, once we remove with a single dose ampule, slightly bend the ampule so that we will get the correct amount of the medication. So, the medication we will get is 1 cc. 1 cc. So here, carefully do not touch the rim because so that there would be no contamination. Next is to prick or remove excess air into the syringe. So here is the 1 cc. So next dispose this in a appropriate container. So next, if we do a or giving a injection, replace the filter needle with a new needle. So we will just remove this. Carefully remove this. Next, push the solution into the prescribed amount. And that's it. And dispose the filter needle in the appropriate container or trash bin. Next is to perform hand hygiene. Lastly is preparing medications from the vials. So first step is to assess the allergies to medication, scientific drug action, side effects, interaction, and adverse reaction. Next is the client's knowledge of and learning needs about the medication and the intended route of the parental medication to determine the appropriate size of syringe. And also the ordered medication for the clarity and expiration date. So next is to prepare the materials. We have here the MAR, vial, alcohol swab, and syringe. So first is to check the MAR. Compare the MAR and the label of the vial if they have the same, so that the medication would be the same and correct. So ampicillin 500 milligrams, so they are the same. And always follow the 3 checks in administering medications. So next is to perform hand hygiene and observe other appropriate infection prevention procedure. Next is to prepare the vial for reconstitution. So read the manufacturer's guide. Next is to clean the previously open vial or top of the vial by rubbing it in a circular motion so that there would be no contamination. Now we go on into withdrawing the medication. So ensure that the needle are firmly connected with the syringe. Next is to remove the cap and draw an air equal to the medication with Next is to carefully insert the needle onto the rubber cup. Insert it on the rubber cup so that it will remain sterile. Next is to carefully insert the air. Next, hold the vial and the syringe and draw the amount of the medication. So the medication air that I drew earlier is 1 cc and the medication that I will get also is 1 cc. So 1 cc. Next is to withdraw some air onto the top of the vial. Next, if the correct dose is already in the syringe, and carefully remove the syringe into the vial. If necessary, take the plunger to remove some air and bubbles. So that's it. Put it on the medication tray together with the MAR. Next is to discard the discard the use items or things in the proper receptacle bin. Next is perform hand hygiene and do documentation. And also, I will be adding is the if multi-dose, label it with the name of the vial and the date and time it was prepared. Also, the amount of the solution and your initials. And when administering injections, use another syringe, replace it with another syringe with same gauge and length. Next, so we will gonna replace it. First is to remove. Careful not to touch the needle because it should be remain sterile. And that's it. That's the 1 cc for vial ampicillin. Thank you.